Mahama has directed the Ministries of Health and Local Government to institute a national cholera control plan to help the country deal with the epidemic. The president hit the streets over the weekend in a bid to incite communal spirit that rids the city of filth. He visited two hospitals, the first being the La General Hospital and the Lekma Hospital in Teshi.
President Mahama hit the street on Saturday in a bid to incite communal spirit that rids the city of filth. He visited two hospitals, the first being La General Hospital. He was presented with the many constraints the hospital face, especially in this epidemic.
I must say that the health workers are overwhelmed under the circumstances because the cases come in 20s and 30s. The hospitals run on internally generated funds. And where I showed you earlier the cholera bay, it used to be a tent, but we had built that building from our own internally generated funds. We need infrastructure. Using the OPD is uncomfortable because you are putting people who are dehydrated on benches. But the health insurance paid this hospital only up to February, and we are almost in September. The lift, we have a lift here. That for years, the lift has not been working. The theater is on the last floor. It means that pregnant women on a daily basis climb to the last floor if they can. If they can't, it becomes an additional job for us to carry them up.
His entourage presented some fruits to support recuperating patients as the president encouraged them to deliver quality health care in spite of the challenges.
I want to thank the staff for the dedication I've seen, during my visit here. They're working under trying circumstances, but they're doing a very good job. And so I urge you to keep it up. One of our government to support you.
At the Lekma Hospital, President Mahama interacted with some of the patients and officials at the hospital, taking account their unique challenges as well. Municipal Health Director Dr. Adelaide Riafe told the president that inadequate water supply and bad sewage systems continue to hamper the fight against cholera.
Fortunately, we haven't had any child dying out of cholera. Probably it's because of Ghana Health Service policy of adding zinc and vitamin A to children with diarrhea. So is it possible to look at that direction for adults who present with cholera? How can we make sure that water supply is adequate and has good quality? I think that is the way we should go.
She called for more sustainable measures.
I think we need a national plan for cholera prevention and control in this country, as some countries have. This plan should include all the sectors, all agencies, health, sanitation, water, engineering, and all the sectors, so that we come out with a long-term plan, and then we will not have to be dealing with the short-term measures of eradicating cholera or dealing with cholera. But the sustained prevention, to me, is the way we should go.
President Mahama responded in the affirmative.
As the doctor said, I'm going to charge the Ministry of Health and the Ministry of Local Government to come together and come out with a national plan for the prevention of cholera. I'm sure that if we do things right, we'll be able to make sure that there are no deaths from cholera. It is not a very respectful thing to have people dying of cholera in your area. What it means is that the area is dirty and that people are defecating outside. So let me commend the regional directorate, the municipal directorate, and thank the municipal chief executive for the help he's giving the hospital to set up the new isolation ward. As we could see, the emergency is full of people. You can't even get beds for them to lie on. Ideally, they should be lying on beds and taking their drips, but there are many people sitting on chairs and taking their drips. And so that center would help very much.
Here also, baskets of fruits were presented to support recuperation.
The president. Right now, I'm joined over the telephone by PRO for the Ministry of Health, Tony Goodman. Tony, you're welcome to the program.
Thank you, Kamini.
Tony, so now you've been charged to have a national cholera control plan. What are we going to see happen?
Thank you very much. Good morning to our viewers and listeners. Yes, we've quickly done something. We've identified the causes. We've identified areas where we have to contain this disease and quickly do some work there. We've identified that it is whenever you have rains coming in, you have floods, where you have pipes being passed through gutters and those pipes are broken, you have cholera. So quickly, our plan is to put surveillance in those areas. In terms of diarrhea, you quickly will have to advise the person to visit the hospital. We are going to those communities to do what we call public education in those communities. We are in talk with the Ministry of Water Resources to at least supply water to some of those areas. Our plan is also to, we've identified that some of those pure water and the rest that we see in the system can also be a point of contamination. You have a tanker that goes to an area to fetch water in a stream for a contractor. That same tanker gives you water for you to drink or to sell to people. You might, at the end of the day, transmit this VIBU or cholera to people. So we are in talks also with the Food and Drugs Authority to go in and also publish companies or water sachet companies that are not registered. Those that are registered, we can stop them and then provide them with water for some period from the national grid. We make sure that those guys get water from a particular source. Then we'll be able to monitor and see how best we can reduce this cholera. So these are some of the plans that we've triggered. We've sent what we call case management guidelines to the regions. It will go to the districts, what there is to do. We've quickly deployed some medicines, infusion to hospitals that are in need for usage. So, Kemeni, these are some of the things we've already done.
I see, Tony. This
Yeah.
plan you have outlined, it's considering it's supposed to be a national cholera control plan. It's rather reactionary, and I haven't heard any proactive to forestall future outbreaks, any proactive measures to forestall future outbreaks. How's that?
What you do in such a situation is to have some plan that contain the spread, some plan that to minimal what we have as a nation and look into the future. So that is what we're doing. When you look at the cases, we are saying that most of the cases are transported from Accra to those areas and those districts or regions. You can just trace and see those three northern regions, the northern, upper east and upper west, have not recorded cases because of their proximity from the capital. So you have to identify the case and break in transmission before you can put in place a plan that is solid and can help you at least go into the future without having cholera. So those are some of the things we are doing.
Tony, that sounds like this is the first time Ghana is experiencing cholera.
No. You see, it is a disease or it is an outbreak that you have when you have rain. So you start education, try and control it before it gets out of hand. But where you are not sure of the area where it will start from, these are some of the plans we need to put in place.
The point I've been driving at is the fact that you didn't have to take a suggestion from a health officer at a particular hospital to the president for the president to direct the health ministry and the local government ministry to come up with a national plan for a disease outbreak that has plagued the country for many, many years.
My sister, where we've gotten to, we've got where the leader of the country, essentially the president, to show that leadership. The president takes charge of those things. He is responsible for whatever. So if he's calling on his appointees to put together a national plan. I think it's not far-fetched.
Then
it is something
you see, then it raises the question: what then have we been doing at the ministry? Because then, if this is something that has been with us over the years, then the ministry should have come up with a plan for this. It shouldn't have taken the president to charge you with it.
We have a plan as an institution. That is what we used last year. That is what we are using. Last 2 years, we did not record any cholera case. That tells you that there were people who were working. This time around, they're calling 2 or 3 institutions to come together and put a national plan. You would have your own plan as a ministry of health. Local government also have its own plan, and then we'll be using. Now you have to put together all those plans and have a national plan and be able to work together. So it is still a plan that you need to put together as an institution. Yes.
Then this your plan, it hasn't worked well so far, has it?
It has. But dealing with individuals, you're dealing with people, then those are some of the things that you need. What we should be saying is, why should we have cholera? When you look at the cases, it is personal hygiene that we've thrown to the dust that is costing us. So it is individual issue, and to change behavior, behavior change takes time. So we'll continue to do this. You, the media, have to also help us to tell people not to throw rubbish about, because you will not expect this of health to now go out and be telling people don't throw rubbish about. It's part of our what we call the health promotion campaign. But if you have people who are still doing people defecating around, then your plans will be thrown into gear. So those are some of the things that we see. It is individual issues, personal hygiene that we are not taking seriously, that is causing us a lot.
Tony, I've also spoken with a researcher, a scientist at that, who's mentioned the fact that we could actually predict the movement of this cholera bacteria, especially when we study how it comes about, where it starts from. What has the ministry done in this regard?
Yes, Ghana Health Service is doing that now, trying to look at where those cases are and see what best we can do in those areas. We're also looking at possible vaccines, but we're told that will not be the way forward. The way forward should be making sure that we clear our communities of filth. So yes, we have a plan, and Ghana Health Service Public Health Division is looking at that, and we hope that this will help us to move away from where we are now.
How are we going to see these two ministries work in documenting this national cholera control plan, the local government ministry and your ministry?
Yes, we're going to do this. We normally have what we call National Technical Coordinating Committee. So we're going to put up a plan like what we have for Ebola. We're going to have a plan that will come from these two institutions targeting the control and the reduction of cholera in those communities.
I see. But these two ministries have not met yet, have they?
Oh, no, we've been meeting. We have various institutions, not only Ministry of Health and local government, but other institutions like the Ministry of Environment, local government, some district assemblies. We also have some agencies who are part of the National Coordinating Committee. It is a technical group that meets every Tuesday to look at outbreaks. We have NADMO, Interior, and the rest on board. So we're going to put together a plan. There is a plan, but this is going to be looked into properly to see how best we can contain the disease.
I see. We'll leave it here for now. Thank you very much, Tony.
Thank you,
Goodman is PR for the Ministry of Health.